Hello and welcome, Doctor. My name is Eshika Paruchuri, and I'm a sophomore at Woodbridge Academy Magnet School. I appreciate you joining me in this initiative. My primary goal is to educate adolescents globally, empowering them to build healthier lifestyles by collaborating with experienced doctors across various specializations. Welcome to the Healthy Teens podcast. I hope you are keeping well. This month, I'm joined by Dr. Ansel, who specializes in optometry, helping patients with eye care and deals with conditions including myopia. And for this episode, we'll be discussing the various aspects of optometry that will help teens maintain healthy eyes and a lifestyle. And now, Dr. Ansel, can you give us a little background regarding your experience in this field?
Yeah. First of all, thank you so much for having me on. I'm very excited to be here, and I'm always happy to spread knowledge about eyes and optometry in general. Yes, my name is Dr. Tobin Ansel. I started undergrad. I went to the University of Pittsburgh. I went to optometry school in SUNY Optometry in Manhattan. After that, I did a residency at the West Haven VA Hospital in West Haven, Connecticut, which specialized in ocular disease and low vision devices. I then actually started working there part-time as an attending at West Haven VA Hospital. I still work there currently. And the rest of the time, I split my time in two private practices. One is Metuchen Vision in Metuchen, New Jersey, and the other Somerset Eye Care in North Brunswick, New Jersey. I have been practicing, I finished my residency in 2017, so we're going on about 7 years now. I specialize I do low vision, I do myopia management, and I do primary care.
Interesting.
Yeah.
Okay, let's get started.
Sure.
What is myopia?
It's a commonly used word. Myopia is the same thing, or is the same term as nearsightedness. Essentially, it's an inability to see clearly at distance. Patients have usually, the cause of this is your eye is actually longer than it's supposed to be. So the light that enters into the eye is not focusing on the back of the eye, which is known as your macula or your central vision. So what we do to correct that, obviously, is you put a pair of glasses on, it redirects the light to go right onto the fovea, and that's what makes you see clearly when you're wearing glasses.
Can you also talk about the symptoms and signs of a child with myopia?
Yeah, absolutely. I mean, it's a little bit difficult when they're very young, 1, 2 years old. They can't tell you things are blurry. So it's kind of on the doctors and the parents to kind of look at little clues that could let you know that a child might be nearsighted or myopic. One of the big ones is squinting. Whenever they're trying to see TV or watch, or if mom or dad are a little further away, they can't see them, things like that. Those are like signs or clues that the child might be myopic. Another great one is school screenings, which is why it is important to have school screenings, is because even when children can speak, they don't know that blurry is blurry. Maybe that's just how they feel like life always is, and that's just how the world always is for everybody. So they don't know what clear vision is. So it's up to us to either get you to an eye provider so we can check and see if are you actually nearsighted? Do you need a pair of glasses? So that's where screenings, vision screenings, eye exams at early ages are very important.
How often should a patient have their eyes examined?
So initially, we usually recommend it early on in life, right, before the first or second year of life, mainly to catch any major eye issues or eye diseases. And then after that, we usually recommend right before starting school, so kindergarten or first grade, we want to have another eye exam. Yearly exams, especially for children, are important because they're growing so quickly. So their prescription can be changing very quickly as well. So it's really important to keep up with that, right? Because we don't want our children to ever have any blurred vision when they're trying to learn or see the board. It really can handicap them and affect how well they could, acquire knowledge.
Okay. How important is it to protect our eyes from exposure to UV rays?
Yeah, so UV is critical. So almost every exam that I have a discussion with my patients about UV, because we do know that UV over a lifetime can cause a host of diseases or increase the risk of diseases. two of the main ones are one is cataracts. Live long enough, everybody gets cataracts. It's a clouding of your central vision. That's age related, but the more UV when you're younger, or actually over your whole lifetime, the increased risk of having it earlier on occurs. So that's something you're always going to watch out for. I always educate my patients on that. The other major one is macular degeneration. That's a disease of your central vision that can cause permanent vision loss. So that is also exacerbated by too much UV. So wearing a pair of sunglasses, summer or winter, if the sun is out, you need to be protecting your eyes from UV. And that's what we kind of harp on every single exam.
Okay.
Yeah.
Do you recommend any changes that we can make to our diet or overall lifestyle to improve our eye health?
Yeah. As far as diet, there's been a lot of studies here. I'm sure you've heard about carrots helping with eyesight and eye vision. But main thing as far as diet is to make sure you're hitting all your supplemental goals, right? So making sure you're hitting all of your vitamin levels, make sure you're avoiding highly processed foods, things like that. There's no specific eye vitamin that's needed. But as long as you're maybe taking a multivitamin to make sure you're hitting all your goals, you're really treating your eyes pretty well. As far as lifestyle changes, we're going to get into this in a minute, I'm sure, but screen time is huge, right? So too much screen time, not taking enough breaks during screen time. This has obviously become a much bigger issue in the last 20, 30 years with all the computer screens and things like that. But, that's going to be a huge one, is just watching your screen time.
Are there any activities that can help vision?
Activities that can help vision. Yeah, if you want to consider taking a break from a screen and activity, yes, that could definitely help. You do want to be active outdoors and things like that, because if you consider the eyes, the eye muscles, the focusing system of muscle, like when you're looking up close at a screen for a long period of time, your eye muscles are activated. So you're using your eye muscles. But just like any other eye muscle, you're going to tire them out and you're going to have symptoms and issues. So not only taking breaks, but spending time outdoors, because outdoors you're looking very far distances. So that fully relaxes the eyes. So those kind of activities, playing outside, spending 60 to 90 minutes a day outside, can really help the eyes stay relaxed and, keep your eyes comfortable and help with long-term longevity.
Okay. Can use of things like alcohol or drugs impact eye vision?
Absolutely. One of the big ones that we always talk about is smoking, cigarette smoking. That has a major impact, increases the risk of macular degeneration that we just spoke about. Also increases the risk of a whole host of other issues. Smoking long-term can affect your blood vessels. And as you know, blood vessels run right through your eyes as well. The difference is that the blood vessels in the eye are among the smallest in the entire body. So they're the first to be impacted by any issues. So, high blood pressure, bad diabetes, things like that can all impact those blood vessels and make them much worse. Alcohol has an impact. It's not a direct impact to vision unless you're, consuming excessive amounts, but alcohol increases your risk of any other systemic health conditions, like, again, high blood pressure, diabetes, things like that, that could then in turn affect your eyes and permanently cause vision issues. So alcohol, we always talk about moderation, reducing it as much as you can. Cigarette smoking is a big no. It's an absolute no, because I've seen personally just the impact that just smoking can cause on vision and the way of life that people have.
Can we talk about what lazy eye is and what are the causes of it?
So lazy eye is a kind of a catch-all term. It's for an eye that from birth likely is not functioning as well as it should. There's two main reasons for lazy eye. One is if one eye is just turned outward. So one eye is not focusing on what you're trying to look at. That's usually due, sometimes to an eye muscle issue or anything like that, but one eye is not focusing. That generally can sometimes be corrected with surgery where they recorrect the eyes, but there are other options. Sometimes there's what's known as vision therapy, where we kind of train the eyes to work together. So that's an option to do before you jump to surgery. and that can sometimes get the eyes working together. Another, type of amblyopia is called refractive amblyopia. That's when one eye has a small prescription and the other eye has a really big prescription. What happens is your brain recognizes that one eye is very blurry and the other eye is very clear. So your brain just starts to use just the good eye and starts to pay attention to that and to use that for everyday life. And it starts to ignore that more blurry eye. The problem with that is that, especially when children are developing and their eyes are developing, if you start to get all the wiring to that one eye, this eye doesn't develop properly. So that eye starts to lose vision where it can't, even with the best pair of glasses, it'll never see as sharp as it should. So that's why we need to catch it earlier on, fully correct that vision with that high prescription so both eyes can work together and they'll both develop properly. So lazy eyes is very important to catch at an early age, because then we have the potential to kind of prevent that second lazy eye from getting worse.
You mentioned that catching it early on is, best.
Right.
But what if these symptoms are ignored by the patient? What are the potential consequences in the future?
Right. So the struggle here is, somebody missing it, somebody not catching it. A patient, again, usually they're younger, so it's hard for them to even recognize that there's an issue going on. They just kind of going about their life thinking this is normal. The main consequence is that eye doesn't fully develop. And the reason we have two eyes, a big one, is depth perception. So we know how far things are from us. So if you have one eye that's not working correctly, depth perception is really altered. So they might have deficits, and when they're reaching for things, telling how far something is down the street, those are all affected. So depth perception is a big one. We also have both eyes, kind of as redundancy, right? So we got a backup in case something happens to one of our eyes. So if you have one eye that's not working well, we lose that kind of redundancy of having two eyes. So what we want to do is catch it, make sure they're both working as well as they possibly can. So, God forbid something happens, we have both eyes there.
What are the common eye disorders affecting teens based on what you have seen?
Yeah, so for teens specifically, it's really myopia. As we touched on a little bit earlier, it was the screen time has gone hugely higher than anything that I experienced as a child. And we know that too much screen time, excessive not taking enough breaks, can cause myopia to progress rapidly. And the highest rate of progression is from between 8 and 15 years old, right, during those early teen ages. So that's where it's super important to kind of try and slow down myopia progression during that time period. The other one that we're seeing a lot is a lot of we kind of coin it as computer vision syndrome, which is excessive computer time leading to eye fatigue, eye strain, headaches, things like that. And that's really common, especially nowadays. Even in school, all of our children are using computer screens and laptops. Sometimes they have a one-to-one laptop where they take it home with them and then bring it back every single day. So even school now is computer centric or digitized. So I had a lot of patients that have all their textbooks on screen now, on laptops and PDF files. So the world's changing and is getting much more screen centric, but as a consequence, whether unintended or not, we're seeing a lot more myopic progression where children are having higher and higher prescriptions at younger and younger ages.
How do seasonal allergies affect the eyes? And what care should be taken to protect the eyes during allergy season?
Yeah, seasonal allergies are a big thing, I'm sure. There's a few, especially our patients with contacts, they get much worse off because our contacts kind of absorb the allergens and then keep it in the eye for longer than they should be there. Yes, seasonal allergies are pretty prevalent. Sometimes they're just affecting your nose. You have the itchy, scratchy throat, things like that. But if it's bad enough, it can affect your eyes. It can lead to what's known as allergic conjunctivitis, which is a redness and inflammation of the eye due to the allergies. Typically, in the mainstay, most people are okay with just an oral allergy pill. So like a Claritin can usually take care of it. It doesn't get to the point where it starts to affect the eye, but occasionally that's insufficient. And that's when we start to use eye drops that are anti-allergy or anti-inflammation that can reduce that inflammation, reduce that discomfort. It's important to affect that because if that inflammation stays for too long, it could lead to a lot of secondary issues, dryness, irritation, blurred vision, things like that. So we don't want to let that just hang out. We want to kind of take care of it, especially even if it's seasonal, we want to take care of it as quickly as possible. But as far as long-term issues, not too bad. It's just a pretty big annoyance when you're dealing with it.
How much time should a teenager ideally rest?
Rest, as in like sleeping, like nightly.
Well, we can talk about sleep, maybe how long they should take breaks from the screens.
Sure. Yeah, I mean, sleeping generally, especially for teenagers, I've seen the studies kind of vary, but most of them are saying right around 8 to 9 hours, which I have yet to see too many teenagers able to get there 8 to 9 hours. But I think it's important, not just the eye related, but especially when you're in school, your memories are solidified during sleep. So any type of learning you're doing and things like that, the amount of sleep you get really can affect it. As far as general rest from screen time, it used to be the rule used to be 20 every 20 minutes, look out a distance for 20 seconds. But now it's a little bit different. The more recent studies are showing that every hour you should be taking a full 5-minute break. So 5 minutes where you're not looking at a screen. So not a break where you're looking at your phone. It's a 5-minute break where you're looking at distance. So looking at a window, looking at some streets, like across the street, some trees or things like that, or going for a walk, taking a 5-minute walk where you're looking at something distance. That's what really fully relaxes the eye and allows you to go on longer without having to take breaks.
How harmful is it to self-treat your eyes in case of exposure to harmful gases or chemical burns?
It really depends on what you're treating with it for it to be harmful or not. Most of the whatever agents that you can get in your eyes, if you're doing a saline flush, you're in the clear. Because the goal, whenever there's a noxious agent inside the eye, is to flush it out as much as possible, right? So that's the only way to get it out of the eye, is to kind of flush it out. So even if you came to me and said you got like a bad acid in your eye or a bad base in your eye, I'd be like, all right, sit back, we're going to flush your eye out for 10 to 15 minutes. So that is pretty safe regardless of what kind of thing you are. Now, if you got an abrasion or a cut in the eye, that's a different story. But if you know that you got some kind of chemical in your eye, then it's going to affect you. Then putting just flushing the eye with water is helpful. I would avoid using any type of antibiotic drop or any eye cream, things like that, because depending on what it is, especially if it's an infection, you need to get the right drop for the right infection. So hard to tell if you're not looking at the eye, examining the eye, knowing exactly what you're looking at. So that's where it's important to avoid putting any old drop that you see that's in the back of your medicine shelf. You gotta be a little bit more careful.
How do factors like obesity and diabetes impact eye vision?
Yeah, so I mean, obesity indirectly, because you increase your factors or risks of high blood pressure, hypertension, or diabetes, or a whole host of other issues, cholesterol. But as far as diabetes, there are definitive impacts. The main concern for diabetes is what's known as diabetic retinopathy, and this is bleeding in the back of the eye from the blood vessels. This usually occurs when the diabetes is poorly controlled. So they're not taking care of themselves, they're not using the medication appropriate, and they're not keeping their blood sugars at appropriate levels. And that leads to bleeding because, again, like I had mentioned, the blood vessels in the eye are the smallest in the body. So they're the least able to handle any kind of insult or any kind of problem. So they're going to cause issues earlier on. So there's many a time that I've caught diabetes in patients' eyes before they even knew they were diagnosed with diabetes. So it's really important to have your eye exam. We can catch these things and then we can get them referred for proper treatment. So that kind of bleeding and things like that is really concerning because that could lead to permanent vision loss. So we need to watch that very carefully when we start to see that kind of bleeding issues there.
What is computer vision syndrome?
So computer vision syndrome is just a catch-all term for all the issues that come with using too much computer time, right? So when, like we had talked about, when you have a lot of screen time, your eyes start to get fatigued because it's like a muscle; it starts to hurt over time. So fatigue really comes off in a lot of different ways. One is just eye tiredness. You ever get that like sore eye around your eyes? That's from too much computer use often. Leads to headaches. You just get one of these kind of frontal headaches right here. I have patients that are working IT every single time, every day they come in, they're like, headaches right here. I'm like, yes, I know you're on the computer 12 hours a day. So those are very common ones. Red eye is another one where the eyes just get irritated. Typically, we're supposed to blink 12 times a second, but when we're on the computer, we blink 4 times a second. So our eyes are just staying open way too long and they're drying out. So we have IT professionals, I keep picking on them, but they're the ones that are on there for 12 to 14 hours. But they come in and their eyes are just bloodshot. They're like, why are my eyes bloodshot all the time? It's like, look, you're like so into what you're doing, you're not blinking enough. So, assessing, taking breaks, having adequate lubrication going into the eye because we know you're not blinking enough can make a big difference. So that's kind of an all catch-all term for all of those symptoms that stem from too much computer use.
Interesting.
Yeah.
Does it affect teens similarly as adults?
So you're not going to catch the same symptoms as often because even though our teens are working just as much, teens have better functioning eyes. They're fresh. They're able to deal with insults and difficulties like this much easier. So even though they're spending the same time, you might not see it at all as often, but it doesn't make it any less important, right? Because all of these kind of symptoms are cumulative, right? So years of doing this leads to issues. So even though teens don't experience it, it's just as important that they adhere to guidelines for proper eye care and eye health and around screen times, because when they're 30 or 35, when they start having symptoms, all that time as a teen is really what led to that. So it kind of builds up from there.
Okay. What changes normally occur in a person's vision as they get older?
As they get older, there's a couple of milestones. One is around 40 to 45, and that is called presbyopia, right? So you get old enough, you start to need glasses for reading. And that's natural, that's age-related, that's not anything that anybody did. I'm sure you see grandparents and older adults all wearing glasses for reading, and that's normal. I have patients come in all the time like, what did I do wrong? I don't want to wear glasses. And you just have to explain to them that there's nothing you did. It's just natural. It's great. You lived long enough to have presbyopia. That's a great thing. But that's usually a big one. And that's usually due to our focusing system starting to break down a little bit. The second major milestone that everybody hits is cataracts. I think we had talked about that a little bit earlier. And that onsets anywhere from late 50s to early 60s. And that's a clouding of the lens behind your eye. And it starts to cloud and opacify. And over time, you're not able to see through it as much as you'd like to. And when it gets really cloudy, then we start talking about cataract surgery, which is where they go in and they remove that cloudy cataract lens and replace it with a plastic artificial lens. So those are the two major vision milestones that if you live long enough, you're going to hit both of those. Other ones are more disease related and things like that. So if you have high blood pressure, diabetes, I keep telling those, but those are huge. Those can eventually impact your eyes. Macular degeneration is a disease of older age, usually typical onsets around 70, 75 years old. Those are the ones you want to look out for there.
Okay. Can you tell us about what you have seen evolve or, what you have seen different in the field of optometry from when you first started to now?
Yeah, absolutely. I always feel like I'm still like a young doctor because I'm only 7 years out, but the pace at which technology is changing, especially in eye care, is huge. There's always new things coming out. There's always new research, new data that you have to integrate into your clinical care. So staying on top of it is very, very important and very crucial. So I'm sure you know that all doctors have to take continuing education credits to kind of keep up with this because it's changing so fast. So it's important. What I've seen change so much in optometry is I started myopia management right when I graduated because I was very interested in it. I did a lot of research during optometry school in regards to myopia management. But from 2017 to 2024, the enthusiasm, the awareness, and the general practitioners actually utilizing myopia managers has boomed. It is so much greater. There's so much more information out there. There's so many more doctors willing to get involved because it's only about 20 years old. The first study that came out regarding myopia management was in 2002. Typically, it takes a long time for it to get to integrate into clinical care, but the fact that a lot more practitioners are doing it is great because the potential to prevent or slow myopic progression in children is huge, particularly because there's so much more screen time. So we know there's going to be a lot more myopia. So we got to impact it. We have to be much more proactive in preventing it from progressing. So that's a big one. I've seen so many big strides in myopia management, and it's fun to be a part of, to be on that cutting edge and be able to provide new treatments just as they're coming out. It's something that keeps me excited.
That's very interesting.
Yeah.
Can you talk about a case that you've had in the past where you've dealt with a patient with this very intriguing condition or something that just interested you?
Yeah, so maybe just about a month ago, this one was a little bit of a sad case or a scary case. I had a 13-year-old who had come in and said he had a little bit of pain in his left eye, a little bit of blurred vision. He had gone to his primary care doctor. They had thought it was just the conjunctivitis, which is like a pink eye, and given him an ointment. But the pain, the vision blur wasn't doing so well. So they come in, the right eye is great, 20/20. The left eye is not seeing much vision at all. So it was very, very, very reduced vision. And obviously, once there's reduced vision where it's that asymmetric, we think about lazy eye or things like that. But I was talking to the mom, I was talking to the kid. They said they went to an eye doctor 6 months ago, and both eyes were 20/20. So that's where my alarm bells go off, and I get a little bit concerned about that. So I put the drops in, the dilating drops, which open the pupil up really large, so I could take a really good look at the eye. And then when I was looking at that left eye, there was actually edema. There's like fluid buildup in the optic nerve there. So this is really rare in general, even more rare in a 13-year-old. So obviously there's a lot of concern here. There's always some concerns for tumors or if your brain has a fluid in it, so if the pressure goes up really high in that can cause some swelling of the optic nerve. So we had to send him for imaging, like brain imaging, MRI imaging. So we did that imaging, and it showed that there was just this localized inflammation of the optic nerve. We're not always sure why it happens. Sometimes it could just happen on its own, but the main course is that they need to start what's known as intravenous steroids, for a really strong anti-inflammation medication that they put through an IV. So he was started on it that night to kind of get that inflammation down, because if that inflammation stays too long, then the vision doesn't come back. So we had to be really on top of it. It was an emergency case. We sent him out to make sure that they got that high dose steroid there. And luckily, he recovered his vision fully. So now he's at 20/20 again after almost seeing nothing. But the concern here is that we did all the tests, and there was no real reason why he had that inflammation of his optic nerve. So the concern is, if we don't know why, do we know if it's going to happen again? So like that's always in the back of our head. Yes, we took care of it, everything's great, but we don't know why. And that's always the toughest part sometimes with medicine, is that there's not always an answer, right? We could treat it, we could take care of it, but without knowing why, we don't really know how to educate the patient. We don't know how to really treat it forever. So it was a great outcome for now, but we're watching him very closely to see if there's any other issues or anything else that can come from it.
That was a very interesting case. I think the steps to prevention were, they were like taken good to prevent that.
Yeah. I'm glad he got seen, and glad he got taken care of quickly, because that time was really important.
Okay, so with that, we have concluded our first section and we'll now move on to common myths about optometry.
Okay.
Carrots will help vision.
Carrots, you said? Oh, yeah.
Carrots.
Yeah.
Carrots.
Carrots are, have a lot of supplements and, a lot of multivitamins that are helpful, but carrots themselves are not helping eyes specifically. As long as you're getting your supplement levels, like vitamin levels, and meeting them appropriately, then you're doing good by your eyes. So carrots are great; they're going to help your eyes, but anything that's going to help you with multivitamins are going to help you as well.
Okay. Optometrists and ophthalmologists are the same.
I would not say we're the same. There's education difference for sure. Ophthalmology goes through medical school. They do 4 years of medical school, and then they specialize in a residency with a specialty in ophthalmology. Optometrists do a 4-year optometry school, and then we do a 1-year residency. The main difference that I always see is that ophthalmologists are the surgeons, right? So they're doing surgery, right? So that's where their home is and what they do. So they're cataract surgeons, glaucoma surgeons, retinal surgeons. So they treat things surgically that are needed to be treated. As far as other conditions, though, diabetes, macular degeneration, high blood pressure issues, amblyopia, which is lazy eye, those all conditions we overlap. So I like to think of optometrists as your primary care eye doctors, right? So we take care of the main things, and then if there's an issue, we know where to send you. We'll send you to the glaucoma surgeon if you need glaucoma surgery. We'll send you to the cataract surgeon if you need cataract surgery. But we kind of handle most of the things similar to what ophthalmologists do, but they are the surgeons. I'm not cutting into people's eyes.
Optometrists deal with conditions around the entire eye.
Yes, absolutely. Yeah. So we from the front to the back, we take care of the eyes, whether it's a conjunctivitis or a dry eye, all the way to the back, whether we're managing diabetes in the back of the eye or macular degeneration, optic disc edema, which has just happened 2 weeks ago. So we manage everything that can happen in the eye. And if there's something that's surgically needed or things like that, then we know who to send it to, and what we call is co-manage them, right? So we manage them for all their things, and if there's something specifically that the ophthalmologist needs to handle, they'll be handling them surgically or managing them at a higher level.
Okay. I don't need to wear glasses if contact lenses will correct my vision better.
Yeah, well, contacts do correct the vision, right? So if you're wearing contacts, you're going to see clearly. It's not an issue. The concern is when it's known as contact lens overwear, right? So if you're wearing it 16 hours a day, contacts are, no matter what you do, even if you get the best contact, there's still a piece of plastic in your eye, right? So they're naturally going to dry out your eye a little bit. Whether that's 12 hours of wear or 16 hours of wear, they will make your eyes a little uncomfortable eventually, and that's from dryness. So what we always recommend, what I always recommend, is either getting out of the contacts a little earlier so you still have a couple hours where you're in glasses, or taking a weekend day off where you're just in glasses all the time. What that allows is your eyes to just breathe a little bit. Our cornea, our clear part of the eye, or the colored part of the eye, gets all of its oxygen from the air. There's no blood vessels. So whenever you put a piece of plastic on, you're preventing all that oxygen from getting into the eye. So you want a couple hours where your eyes are open, getting oxygen, and there's no plastic in there blocking it. So contacts are fine. They're very safe. They're not going to cause any issues, but it can't just be right when you wake up to right before bedtime you take them out. So it's got to be a little bit of time where your eyes are open without the contacts.
Okay. Okay, so let's move on to our final questions. First, we'll start with a scenario case. Let's say that an individual notices that they squint often when looking at objects at a distance. However, they decide to ignore the symptom. Why can ignoring symptoms like this create an impact in the future?
Yeah, so I mean, depending on the age, it can have a big impact, right? So if a child is blurry or can't see the board, and parents don't know that, the educator, the teachers don't know that, and they put them in the last row in the back of the class, they're not seeing the board, right? They might be embarrassed, they might not say it, but they're not seeing the board. And then, long term, they get labeled as somebody that can't pay attention or doesn't do well in school. Meanwhile, they're handicapped. They can't see it. So it's not a reflection on their knowledge or their ability to learn. It's just the fact that they can't see the board. So if it's uncorrected, they have long-term issues as far as how well they can succeed, how well they can flourish in school. And that's a big problem. On the flip side, as far as clinically, if an individual is uncorrected, myopia tends to progress faster. So we want full correction whenever we can, because that slows down the rate of myopia. So if they're uncorrected, their numbers are actually going to change faster than if they were fully corrected. So there's a lot of different aspects there to ignoring that kind of vision issue.
Okay. And finally, what is your take on Google Doctors?
Google Doctors? I'm all for patients wanting to be educated, and I think Google has actually helped them be very educated. I think the issue is I'm happy to answer questions when patients come, and I love answering questions. I love educating. That's what I'm passionate about. But the issue becomes is when you decide to treat based on what you saw on Google. That's my concern, right? So they'll give you a list of 13 different treatments, and you just go down the list, self-treating everything. Where when it comes to certain conditions, only the right treatment is going to help you, and everything else is going to hurt you. That's where I get really concerned. So absolutely, great resource to get your knowledge base. Ask more educated questions when you're in the doctor's office. Terrible resource to self-treat. So that's where I kind of draw the line.
Agreed.
Yeah.
And with that, our podcast session has now come to a conclusion.
Yeah.
I want to express my gratitude for your time, insights, and contributions. And for our listeners,
nourish your habits to flourish your lifestyle.
Thank you.
Sorry.
Don't forget to follow us on our website, healthyteens.net, and stay tuned until the next episode. Take care.